Have you ever seen someone fall onto the floor and start convulsing due to epilepsy? My name is Alicia Statler, and this is my informative speech. I want to start off by telling you about what epilepsy is. Then I want to discuss with you a couple of the treatment options that epileptics can use. And then I want to finally talk to you about Josh's story, because I'm pretty close to him and I've actually witnessed some seizures. Epilepsy is a disorder that results from the surges in electrical signals inside the brain causing reoccurring seizures, states Mayo Clinic in 2011. Seizures can be a pain in the butt, says Josh. He finds them to be annoying. Seizures can occur in people of all ages, from infants to age, and can result from many causes, including genetic variations, illnesses, head injury, and abnormal brain development, said the National Institute of Neurological Disorder and Stroke in 2011. When someone has a seizure, they usually convulse and their body shakes. They usually stare up onto the ceiling and just convulse for about 5 minutes or so. And then sometimes they try to get up and start walking around. Some treatments that I want to discuss with you are surgery and medication. Surgery can help treat people with epilepsy. The Epilepsy Foundation in 2011 stated that brain surgery can be a successful way to treat epilepsy, only if seizures are in a part of the brain that can be easily removed without damaging important things, like important areas of the body or of the brain that lead to functioning, like Broca's area or the frontal lobe or any of the other areas of the brain. Some medications you can be on is Depakote. I'm pretty familiar with Depakote because that is what Josh was on. Depakote affects neurotransmitter NYP to block seizures, said Fisher in 2010. So the medication that you're on won't cure epilepsy, but it sure will help prevent seizures and block them from you having them. I want to finally talk about Josh's story. Josh is a confirmed epileptic. When he was an 8th grader, so around 2002 or 2003, he had his first random blackout. His random blackout involved him stumbling around the kitchen and just doing normal, everyday things, and then he would just fall to the ground and be blacked out for a couple minutes, and then he would come to and get back up and keep doing what he was doing. Those random blackouts were followed by severe seizures. His mom recalled one night he was out in the kitchen just like stumbling around and falling everywhere, and so she got up and she heard him and she put him back into bed, and when he got up the next morning she asked him about it, and he was like, I've been sleeping all night, like I don't remember anything. So that was his first seizure. So then he went to the doctor and he was a confirmed epileptic. His EEG brain scan came out normal for epileptics. He was put on a high dose of Depakote. He was made take pills 3 times in the morning and 2 times at night. That's how severe some of his seizures were. Today, Josh has rare seizures. They usually occur when he gets a lack of sleep, but he works out on a farm, so a lack of sleep is he doesn't get that much sleep as it is, because farmers have to get it done or it'll die or whatever, so he has to take time. So I ride his butt so he gets his sleep so he doesn't have a seizure. His last EEG looked so good that he's off meds, but he's going back on them because he's been having seizures about once a month since May. So in conclusion, epilepsy is not a life or death thing. Remember that epilepsy is a disorder that results from the surges in electrical signals inside the brain, causing reoccurring seizures. Remember that some epileptics can have surgery to treat their epilepsy, and some people can be on the many variations of medication. Finally, remember Josh's story and how he used to have seizures, but now he's going back on medicine